Good morning. Thank you so much for being here today. For many of you that I haven't met, hopefully I'll get to today. My name is Shelby Duplessis. I'm a parent of 2 students in the Peoria School District and live here in Peoria and have ever since our daughter was born. Just absolutely love the city and love the West Valley. And basically started working with the Peoria Police Department on this program back in December of 2013 when they started this program and wanted to start bringing drug awareness to the West Valley as more of an education and awareness to parents to keep their eyes open, and to the community and community leaders. And from there, it's since grown. We've done numerous events since that event at CCV, with the City of Glendale, with the City of Surprise, Wickenburg, Liberty High School. We just keep going around and talking to different groups about heroin and education awareness resources, and just getting the communities involved and aware of what's happening and trying to make a difference. This is our next step, is bringing all of you together to talk more about that and where we go from here. I'm so happy to see everyone here and really looking forward to making a difference. I'll be honest, I think we've gotten to a point in the program where it's now out of my education and awareness, and I'm learning so much. I don't feel like I have much to offer other than to take everything in that I get to hear from all of you today and actually start just making sure that we keep collaborating as communities. What we've heard here already in the room today has been extremely impressive in just less than an hour. Different groups that haven't talked. The groups that are together at your table is to get that demographic mix and to have everyone talking amongst themselves about their side and what they see as missing, and bringing awareness to the other side and getting more collaboration going. So thank you so much for making this happen, and we look forward to expanding the program. I am very honored to introduce to you a friend of mine and now the City of Peoria Mayor, Kathy Carlott.
Good morning. Thank you all for being here today. It's amazing to me how great this program has taken off, how much it has grown over the last couple years. It's really a testament to the people who care so much about our kids and our community. So I thank you for everything that you've done to bring this program forward. You know, these kind of community conversations are priceless. And I'm going to give you an example of a time when this kind of conversation was not available to a particular family. It's very near and dear to my heart. When we moved to Arizona when I was 11 years old, we moved into a nice middle suburban community and neighborhood, and next to us was another nice middle suburban family. We had 3 kids in our home and they had 4 kids in theirs, and you know, we were all close in age and we grew up together. We played, you know, in the neighborhood together. We went to the same schools. We hung out with the same crowd of people. You know, we had all of our friends, our group. It was a great wholesome community, a great wholesome neighborhood. And then, when we were in our teens, something changed. One of the kids from the family that lived next door to us got addicted to heroin. And something big changed. It wasn't just a change that affected Brad. It was a change that affected us, our family, his family, the entire neighborhood. You know, I'm just so sorry to say what happened. His father, his parents, didn't have this kind of community discussion available to them. They thought they could just love him enough to overcome his addiction to heroin. And you know, it's a wonderful thought, and wouldn't it be great if that could actually be true? But of course it isn't true, and it wasn't true for them. And as his addiction, as his addiction became more and more severe, he needed more and more money, of course. So he started stealing from everyone in the household. You know, the stereo equipment, the TVs. Before you know it, all the kids had bolts on their bedroom doors. But every time the dad would go get that stuff back out of Hawk, he would use his money and family money and buy it back. And then, you know, it was bigger things, and then it was check fraud, and then it was, you know, really big theft and having to bail him out. And before you know it, there's a second mortgage on the home, and before you know that, then they lose the home. And then they have to move, and they have to leave their neighborhood, the proximity to their friends for all the other kids. Their retirement was gone, their savings was gone, and their permanent home was gone. They continued to try to love him through that, but there was a lot of havoc in their household. There was violence, there was dissension, there was hatred, there was fights, there was an environment that was a wholesome family. Prior to that, no longer was that. They were dysfunctional, to say the very least. Of course, we all grew up, and I moved away, and when I came back for their father's funeral, my friends, those kids I grew up with, behind their tears, they had nothing but negative things to say about their father. Their father, who had the best of intentions, couldn't protect them from such a horrible drug, from such a horrible thing that happened to their family. He went about it without any kind of education or knowledge, the kind of things that you guys have. He just didn't have access to. And so he tried his best. But what happened was he ended up with 3 other children who felt slighted and betrayed and so many other terrible emotions. And they were just cussing under their breath at their father, who was now passed away. Unfortunately, their mother, who was just the sweetest woman, ended up penniless and spending the rest of her life working to try to support a son whose only function, apparently, was to get up every day and go down and get his methadone treatment. And that was all he did. And to my knowledge, he might still be doing that. She's since passed away, too. And their family is not close, and they sort of lost everything that was the foundation, the trajectory of that family. It could have been so perfect, and it ended up being absolutely opposite of that, because they didn't know what you guys know. They didn't have the opportunity to sit in an environment like this and learn as you are and discuss it as you are. So Shelby, what you started is probably more than you could have ever understood. And if those people had known Shelby and had known what was begun by all of the people in this room and continued on by all the people in this room, everything could have been different for those people. And I hope that what you're doing today saves the next family and the next and the next from what happened to my good friends. I wish you the very best, and thank you so much for your contributions to our city and our kids.
My name is Sergeant Jeff Carpenter. I'm a patrol sergeant here at Peoria. It's my pleasure to introduce our next guest speaker, is Mrs. Debbie Moak. Mrs. Moak comes from the Governor's Office for Children, Youth, and Families. I always transpose the names there. Debbie's got a great history of being involved in the community, being an advocate for children, one of the founders of Not My Kid. We crossed paths not long ago in a follow-up of the special you might have seen on TV, Arizona Hooked. She was part of a panel with that afterwards, and graciously volunteered to come out here and speak to us a little bit from the Governor's Office. Was appointed in January. Correction. So still getting her feet squared away in the office here, but we're glad she's here and look forward to her sharing her thoughts with us.
Thank you, Sergeant. Well, good morning, everyone. Thank you for having me here, Sergeant Carpenter. It's a privilege to be here and exciting to see so many people in Peoria turning out, enthusiastic to make a difference in your community. Love seeing that. If I shake, which I will, it's not nerves. It truly is that exciting to me. Not only, so just a brief background, I come originally out of education, was a classroom teacher for 10 years, founded a nonprofit that deals in behavioral health with the #1 category of programming, substance abuse, and our audience was both youth, parents, and faculties. One of the things I'm most proud of that organization for is we employed young men and women in recovery and trained them and put them into classrooms. We've had that program evaluated, and it's off the hook effective. Can you imagine what a difference you can make when you send young men and women who've lived this peer-to-peer into their classrooms with appropriate training? So I'm so proud of the work that they're still continuing to do. From the governor's office, I really did want to share a few things. Additionally, though, I need to tell you that, yes, I'm grateful for those pieces of my background, but that's not what brings me the passion that I have today. I am the mother of a young man in recovery. He's not so young anymore. He's actually a grown adult. That makes me passionate to do whatever I can to work on this issue, right? It is what drives me every day. And it is why I accepted this position in the governor's office. Was pretty happy with what I was doing, but I saw the opportunity to do something far greater. What I've learned in the 3 months that I've been on the job, I'd say my biggest aha is that government has lots of experts doing lots of great things. And over here, typically, we have the private sector, the corporations, the community foundations, private individuals, and neither the twain shall meet. It's been one of my biggest learnings. So job number one for me is bringing these two together. I wholeheartedly support the governor's vision of private and public partnerships. If we really want to make an impact, we can't ask government to solve everything. The private sector is not going to solve everything. Quite frankly, it's going to take all entities, certainly on the front lines, our law enforcement, as well as our educators, our families, our community foundations, and I am actively working on that goal. Tomorrow, as a matter of fact, I host yet again another meeting with all of these entities. Coming together, it's been a little bit like trying to push magnets together that naturally repel. And I'm saying to them, look, this train has left the station. Hop on or hop off. But we are full force ahead on these issues. Before I even start, and I'm going to make just a few comments, and then I'd really like to just hear from you. What could I answer for you from the governor's office? I do want to tell you that on October 22nd, it is the day before Red Ribbon Week begins. What we are doing, we have reserved the Senate lawn, we have reserved the governor's time, and I am extending an invitation to every one of you right now and your community. We are going to really do two things. Provide education in tracks, and we're working on those tracks right now, to educate the community on substance abuse. What is really happening in the state of Arizona and across the country in regard to substance abuse? And these tracks, we're going to run them all day long. We're going to target our state agencies, law enforcement, teachers, educators, community, as well as youth. So I hope that you'll plan to be with us. We're also going to be asking targeted nonprofits, resources to be a part of this event and actually set up booths for resources. I'm very excited about that. I will tell you, we were in an initial planning meeting, our very first meeting, and who did I invite to help me kick this off? Well, I tapped some of the most amazing people on the planet. They're all moms who have sons and daughters somewhere in the continuum of recovery, many of which are incarcerated right now. And these moms are motivated to roll this out. The second thing we're going to address that day is we're going to chip away at stigma. You know, as the mother of a recovering addict, I know my son has a disease. And quite frankly, we moms and many of those addicts that are in recovery that I speak to, we're tired of hiding in the shadows. I didn't cause my son's addiction, nor can I fix it. But we're not hiding in the shadows anymore. So these moms, we're all coming together as a community to say, and here's our whole campaign. We're sitting in our first planning meeting, and the moms say to me, so what's our theme? What's our message? And I said, the message is the elephant in the room. And the one mom starts to cry. She's an artist. She had painted, already had in her possession, one painting that she had never placed. She pulls out her iPad and shows the rest of the moms. It's this giant elephant. And she said, I titled this piece already. It's called Now You See Me. The elephant in the room, and that is our theme. So we're going to educate our community, and I need your voices. So watch for that. I'll be sharing additional information with Sergeant Carpenter and other opportunities from the governor's office. I want to touch on just a couple and then open it up to your questions. I grabbed this off of my table. One of the questions says, if you were head of your organization and had unlimited resources, what would you do to address the problem? Well, wouldn't we all like to have unlimited resources, and yet none of us do, not even your governor's office. But I will tell you that I love the approach. I'm so fortunate. I get to come into an office where there's been 2 years of planning in regard to RX drug misuse and abuse. So I get to implement a really thoughtful, collaborative plan by ACJC, the Governor's Office for Children, Youth, and Families, and the Department of Health Services. And this is the toolkit. 500 of these were just delivered to our office. What I love about this toolkit, and I'm going to be leaving it with Sergeant Carpenter, is that it has a very multidisciplinary approach. In no way do we believe that any one entity is going to solve the issues that we're facing here in Arizona. There will be lots of trainings happening around this toolkit, and I will make sure, and if you'll check in with volunteering Sergeant Carpenter, we'll keep you abreast of those trainings. There will be special tracks for law enforcement. I hope that you'll be thrilled to know that this group, one of the areas they targeted were pharmacists. Pharmacists are receiving a report card on their painkiller subscribing practices. How do you like that? Isn't that wonderful? It really is. And this was piloted in 3 counties with some amazing results. Therefore, it's ready to roll out. I would tell you that the most likely rollout time frame is back to school. So we'll make sure that you have more information. There's not enough time today to walk through all the training, but I'll just touch on the 5 areas of focus. Reduce illicit acquisition and diversion of prescription drugs. Promote responsible prescribing and dispensing policies and practices. By the way, that group is literally, we like peer pressure. We're talking about saying, very soon we're going to set a deadline and your prescribing practices will become posted, your report card, public information. Enhance RX drug practice and policies in law enforcement. Increase public awareness and patient education about RX drug misuse and abuse. And by the way, we will have even more tools for your community very soon that you can utilize. PowerPoints, handouts, we're going to be creating them for you. Enhance assessment and referral to substance abuse treatment. So those are the things we're working on, and there will be a track for each one of those, and we're putting dates together right now, inviting stakeholders in on all of these tracks with a call to action at the end of each session. I wanted to also tell you something else that I've been working on from the governor's office. A couple of things I'm really excited about. How many of you have heard of Vivitrol? Wonderful. We are actively pursuing a federal grant that would bring Vivitrol to our state. For those of you who do not know what Vivitrol is, it's an antagonist. It's similar to naloxone, but not. What it is a 30-day shot that has a great history and records so far. And by the way, I think this is in 26 other states right now. Arizona is a targeted state to receive these federal funds, and we're actively looking to apply to bring Vivitrol here. It reduces the cravings. Literally, it's very, very different than naloxone. It's a blocker, if you will. So let's say you get high on heroin anyway after having taken the Vivitrol shot. You will not feel the effects of the heroin. You're literally wasting your time. So that's something that we're working on. Very excited to work to bring that to Arizona. Those, again, are just some of the highlights from the governor's office. It is why I accepted this position. I believe wholeheartedly in a very multidisciplinary approach. We've got to all come together if we want to make a difference. Our office funds prevention, treatment, recovery. However, when I look at the state right now, we have dollars spread everywhere. All of the agencies are working very hard to do a better job, come together to say, I'm spending dollars here, you're spending dollars here. How can we pull these dollars together? Our office is also working very hard identifying where there are great programs happening. We want to, and for example, one program I happen to really love the work they do. I learned they were in 7 counties. So we have proactively gone to them to say, how can our office help give you support to grow your program into 15 counties? We need you everywhere. So we're identifying all the best programs, best practices right now, which is a very different approach for, quite frankly, our agency. But it's exciting. In no way do I believe that one person, one agency, one entity can take this on. It's going to take absolutely all of us together. But I'm motivated, love to hear from you. Anytime you have something you'd like to pass on, you think I need to know about Peoria or anywhere else, or how our office can better support the work that you're doing, please reach out. That's really what I have for you today. I am thrilled to take a few questions. Sergeant? Yes, sir.
Give the highlights on your event again.
Yes, it's October 22nd. It's on the Senate lawn. Literally, this group, we're meeting tomorrow, and our next goal is to plan tracks all day long, keynoted by the governor, around these issues. And again, our 2 goals are to educate the community. We want all of Arizona there. I want this to be a real statement from the state of Arizona of how we care about substance abuse, as well as it's time for families like mine to come out. I'm coming out of the closet, which I've done, by the way, for 15 years. But there are many families I've worked with over the last 15 years that haven't. I think families like mine, or I should say families that have gone through this and haven't spoken out about it, we've created an illusion that all is well in our community, and everyone in this room knows, in fact, that's not true. By the way, from my point of view, I don't think there's any greater threat to our state and our nation. One other thing I'm working on in our office right now, we are pulling data from all over the state. Wanting in my ideal world that day on October 22nd, we would be compelling enough that you would care about addiction from a human element. However, if you don't, we're going to address it from the financial cost to the state. We know that this is the common thread running through overcrowded prisons, high school dropout rates, domestic violence. Our girls being sex trafficked, 82% of them have a substance abuse issue. This is the common thread, and we're working on all that data right now to be able to present on October 22nd. Did I answer your question?
Yeah.
Yes, thank you. Yes, sir.
Hi, why are we lacking so much in education in prisons and treatment in prisons for drug addiction?
That's a great question. Why are we lacking so much education in prisons and treatment? Well, I will also share with you that I've been meeting with your amazing boss, Mr. Bill Montgomery, and we are taking a look at a number of things in that regard. We have had discussions, nothing has been implemented, around non-violent offenders, drug offenders, non-sexual offenders, taking a look at a segment of the population, and could we, the last 90 days of incarceration, could we release a few more so that they get treatment and having a set criteria? What I can tell you is we're having the right conversations. Certainly recognizing what your question is. Again, working on it. Hope to have some definitive answers in a few months. Yes, ma'am.
I work in the juvenile sector through the county, and just recently it was decided that we didn't need resources for juveniles in regards to intensive substance abuse. Why is there a lack of resources for the juvenile youth I'm working at a delinquent level for substance abuse?
Wow, that's abysmal.
I can't send them all to the Department of Juvenile Corrections to get intensive services. It was just, a cut was just made where the specific probation was, drug court was cut. And my concern is this sounds great that we're gonna do this collaboration, but I've got nowhere to send my clients.
Sure. No, that's
That needs to be discussed with the government.
absolutely fair question. So specifically, I don't know the answer, but here's what I will tell you. Very often, so we have funding from the federal government. When those grants are cut to our office, we are not able to get money out for certain programs when they're cut federally. I will also say to this, but I care about what you just told me. I would love for you to come in, sit with myself and sit with the staff, and let's take a look. When we are aware of things like that happening, we want to sit down and look for another possible funding source.
Because it's imperative. I mean,
I-
think our programs for juveniles keep getting cut and cut, and something else is more important down there.
Not to me. Not to me.
Feel in my sector.
Well, not to me. So I'm inviting you to come in, let's sit down and take a look let's look for funding. And sometimes there are ways to find it. So come in. You know, the Juvenile Justice Commission does fall under our office. There are some funds there, not enough. The other thing we're doing in our office, by the way, I just got to bring on a grant writer. We are digging for dollars. We are looking for federal dollars to get to you. So come and talk to us and talk about areas of gaps. We know there are a lot. I've been on the job for 3 months, but what I can tell you is, wow, I'm aggressively looking to get dollars into the community in regard to substance abuse. Our staff now, in the 3 months I've been there, they know that the number one mission of our office is substance abuse. So that's a shift for our office, by the way. Yes.
I obviously
Absolutely. Couldn't agree more. We understand that 90% of all addiction occurs during the teen years. So the groundwork for we also know, literally, if a child makes it to 21 without abusing drugs and alcohol, they're virtually never to do so. So that is the goal for our office. There will be a great focus from our office on prevention resources. And we're actively, as a matter of fact, the Sam Burba sitting at your table, I just onboarded him. The governor's office will be not only creating a PowerPoint and materials to you, and again, I'm looking for dollars to get prevention out there for you. Already found some. And the governor's office, a real shift for our office is we're going to be in the community delivering direct programming, because I agree with you. Yes, ma'am.
Good morning. Colleen McGregor with the Arizona Department of Health Services. You speak of prevention.
Yes.
So is it on the agenda to create a community council where you're having representation from the various, I know you're speaking of the October 22nd kickoff or whatever, and
Yes.
you're having your tracks, but how are you going to address it long range as far as preventative services?
Sure, that's a great question, Colleen. Number one, under our office, we actually have 3 substance abuse councils currently. The Arizona Substance Abuse Partnership, the Parent Commission, as well as the Epidemiology Work Group. So we have those 3. As well, I am creating other entities within our office. I believe this group, which is an undefined group right now, other than a lot of motivated people in this arena to make a difference, that certainly has the potential to become an ongoing group. I'd like to bring everyone to the table, quite frankly. Yeah.
And how do we reach you?
What's my number? What is my new number?
I'll send email out.
Thank you. Go to GOCYF.
Well,
Yeah.
I mean, I know how to reach you.
Sure you do.
But there's folks that obviously you're inviting to
I
have
am.
conversations with you. So
And you bet I am. Listen, they have slammed me every hour since I've been there because I want to meet with everybody in this state who cares about this issue, is doing something about it. I need everyone's voice and experience to make this happen. But it's all of us. Got to change the state of Arizona. For me, again, this is the issue. So, if that's everything, thank you for having me, and God bless you for what you're doing in your fields. Wow.
I promise. There we go.
Sam.
Gotta put the questions back though.
Oh, yes, I
Can't take this
am.
with you.
Sam, leave him my phone number.
Well, we as a crowd, as I come to just a minute ago, I don't think we'll have a problem getting the tables to talk about this. Already, there's been some great conversation. Again, introduce myself already, Sergeant Jeff Carpenter. I'd like to introduce our team that kind of has been working on this issue a little bit. We have a small team. We're kind of a pickup team of scrubs, but we're winning some championships here just by the number of people in this room, so thank you. So over here is Justin Hobbs, Patrol Officer of Peoria. Got some mad skills over there. He'll be moderating one of the discussions later on. You already met Shelby Duplessis over here as well. Kathleen Frazier, Adult Probation Officer, been doing that for many moons. Battle scars to go with it. But many of you are in the room today because of her contacts with you and her advocacy far above the normal folks. We have some other people that weren't here today that couldn't make it. Also a couple officers that are helping out from the department. But this is not a cop-centric event by any means. I'm going to cover some housekeeping rules here real quick. I've got the schedule. You got that in the email. Hopefully you got my RSVP email. If you're a late ad and you didn't see the schedule, that's up there on the board. I talk fast. I'm going to talk faster so we can get on track here. If you came here to be entertained with guest speakers all day, that part's over. Now it's on you to have this conversation. I'm going to talk about that here in a minute. So some of the questions you're asking, fantastic. You're ahead of the program, though. Let's get this stuff written down, and we'll get it fed back. So awesome stuff. Fantastic. Go back one, please. So there, see that real quickly here. Discussion groups is where the meat and potatoes. We brought you in here. We've built these tables, these groups deliberately. We've took a cross-section across. We have, if I can get this right, we have educators, probation officers, cops, attorneys, clergy, community members, recovering addicts, families recovering addicts, and a few other people in the room. Treatment providers, how can I forget you guys? Biggest group here. Treatment providers are like, can we go, can we go, can we go? Fantastic. So it's a cross-section, collaborative environment. I'm going to cover a couple of those things. Next slide, please. Here's our goals for today. Keep it simple. Share our experiences, learn what others are doing, collaborate on recommendations, and we'll talk about how we're going to do those. Those are the three big ones. Share, learn, and collaborate. I had no idea that Ms. Moak was going to use the elephant analogy or part of her group, because I've been saying all along is that you've all heard the proverb where you have the 6 blind guys all have a part of an elephant. They all describe it differently because they all have a different part, the trunk, the head, the foot. They don't know what it is. Well, I'm going to bastardize that proverb. We know what the elephant is. We've all got a different part of it in this room. Whatever brought you here today, you've got to hold this elephant, and it's dragging us along. And so now we're going to try and get, wheel it in, reel it in, and redirect it. That's been the goal for this as we go through this. Next slide. A few housekeeping rules. I've been Marine for a long time too, so I'll put it in Marine speak. Rules of engagement. Do's and don'ts. Housekeeping items. Restroom around the corner here if you haven't found it already. If you need a smoke break, it's back out the back hatch here, back door, and around the corner, 25 feet from the door. City code and all that stuff. Hate to do enforce laws today. Coffee and water over here. Thank you to Dutch Brothers for donating the coffee, and also from New Life donating some of the water, so thank you. And then Culver's will be on site later to cook your hamburgers right here. They've donated lunch for us as well. So community outpouring there, so thanks for those folks. Give them an attaboy up front. Again, Shelby is she got some skills over there that comes to getting volunteers. Can't have her though, she's committed, okay. All right, Chatham House rules, not Vegas rules. What's the difference? Chatham House rules, even though we're on video, and I guess we could edit that later on, you can say what's said in here, but non-attribution. So if you have a real desire to say, you know what, Peoria Police is the best thing ever, we won't attribute that to you later on, but you can feel free to say it. You can say, somebody said Peoria Police Department rocks, but you can't say, Sergeant Carpenter said the Peoria Police Department rocks. Okay, get the idea? Vegas rules, what stays in Vegas, what goes on in Vegas, stays in Vegas. Messed that one up, but you understand, we don't want what goes on here to stay in here. We want you to take this, go back to your departments, your agencies, your communities, your organizations, and let it ferment. Talk about it, discuss it. I wish I would have said that. I'm glad somebody said this, and let's get it out there. Let's get the word out there. So that's the idea. Chatham House rules, not Vegas rules. Moderators, raise your hand, please. One moderator per table. A couple of you may not know you're moderating yet. So we have Shelby's over here. Just kidding. Shelby's over here, table 2. I'm back at table 6. Our job is to do 3 things. Get you talking, keep you talking, and stop you talking. That's going to be hard, the last one. We're not there to pioneer the discussion we're just there to help facilitate. But once it gets going, I think it'll be just a lot of head of steam going. I also need a volunteer from each table to be a scribe or to kind of capture notes. There's pens and papers on there. Nothing real fancy. We won't judge your penmanship or your spelling, but I'd like for someone to just kind of keep highlights, because during the lunch, we're going to ask each table to brief back a few things you've talked about. You can use those questions as a guide. Here's the 3 recommendations we would make, or you can say, here's the problem we see, or here's the frustrations. Real informal, but this is really important that we capture what's being discussed. Because what's going to happen at the end of this, I'll talk about how we're going to get this information back out there. But so moderators are already designated, scribes. If you can't write, probably don't want to be you, but someone that just kind of keeps some notes so that we can put those together towards the end during the recommendations. Scribes talk about discussion group, briefbacks, KISS, keep it simple, silly. Everyone knows what that is. The idea again, during the lunch, we're going to say table 1. What say you about what we talked about? Give us some thoughts. As we started to do with Mrs. Mokes there, tell us some of your things you've talked about, some of the frustrations. I'm going to be over there typing away, trying to capture that information, all right? Then we're going to have a guided group discussion where Justin's going to give you some questions, some background, some things, and again, as a group, what say you? Some of them are a little controversial, some of them are some ideas that are being tried elsewhere in the country. We want to see if you think that's something that we need to explore. Again, we take this up, package this up, and push it back out to our decision makers, our policy makers, and our leadership. That's really important that we get this feedback loop going. And then lastly, our second to last, post-event survey. If you're okay with this, I'm going to spam you in about a week, with maybe 2 weeks, with a survey online. And ask you to go to the survey and fill out some of the information. So if there's something you really wanted to say and didn't get to say or didn't get captured, that's a chance for you to give some input. And we'll put that together in the product as well, the final product. And it's also, hey, was this worth it? Was it something you want to do? You want us to drop you off the unsubscribe button we all hit and never works? You can try that as well. But for one time, I'm asking you for a post-event survey. I've got most of your emails. If I don't, please make sure the list is updated, and I will get you that. Give us 2 weeks. We'll get a survey out to you, and you can fill that out. And lastly, it's not up there, is, again, the product. What we're trying to do here is put all this together. We're going to put it together in kind of a point paper format, item, discussion, recommendation, and push that back out. You can have it. You can have it. You can run with it. You can plagiarize it. Do whatever you need to do. But the idea is to get that information out back into our organizations and into our community. Really, this is the first time we've tried this. I'm so thankful you were here. You have no idea how this was just, again, an idea we had that has fermented and germinated, whatever analogy you want to use, and you're here. So thank you for your time. I know many of you have very busy schedules, community demands, so thank you.